Hi, everyone, and thank you for joining us today on this wonderful afternoon. We're just going to give it a couple minutes while we let some more people join in here, as I see there's some people in the wait room. Just give us a thumbs up in the chat section if you can hear us. All the sound is okay. Just want to make sure the audio is working. And just a reminder, this webinar will be recorded and will be sent to everyone shortly after today, as well. If you wanted to rewatch it, or if people weren't able to join us today, or you had to leave early. So if you have any questions throughout, please put them down below in the Q&A section. We'll just give it about half a minute now for just a few other people to join in. Okay, I think we'll begin, and whoever else wants to join us, we'll let them just pop in whenever. So thank you very much to everyone joining us here today for our Hydrate and Access Healthcare webinar, our intro to Hydrate for you. We're so thankful to be here today, and just thankful that you are taking the time out of your day and joining us today. We know that your time is very valuable and precious, so we're going to try and keep it short and sweet. So if there are any questions throughout, please do not hesitate to put them in the Q&A section down below, and we'll get to those. I've also shared Tamara's Calendly link in the chat, so if you have any follow-up or you would like to schedule a one-on-one, please do so there, and we'll be happy to chat with you some more. So I just wanted to thank Mark from Access Healthcare for having us here today. We are so thankful to be partnering with you for this opportunity. So I just wanted to thank you and your team for having us here. And inviting myself. I'm Abby from Hydrate, and Tamara from Hydrate that will be talking today. So I just wanted to say thank you so much for having us.
Of course, yeah. Real quickly, thank you, Abby, for this wonderful partnership that we're forging here. And thank you to everyone that's attending our session today. There's a lot of great information that we are going to learn about. Hydrate is a wonderful company, and we're really, really grateful for this opportunity to afford, new opportunities to our nurses. They'll have opportunities to make more money than they are right now on the side. And we know nurses, especially travel nurses especially, are looking for new opportunities each and every day. So this is really, really wonderful, and we're just very happy to be sharing this space with you all today.
Wonderful. Thank you, Mark. And without further ado, I'd like to introduce you to Tamara from Hydrate, who will be taking us through this webinar.
Hi, everyone. So as she said, I'm Tamara. I'm with Hydrate. A little bit of background about me. I'm also a business partner, and I have been a business partner with Hydrate since February of 2020. I started, I've been an ER nurse for 12 years, but I've completely left the ER now. And I do this on a full-time basis, and then help out with doing things like webinars. So I am an RN myself, so I can resonate with some of the issues that I feel like why RNs are getting away from the bedside or becoming travelers. And so again, if you have any questions, please put them in the Q&A section and we will get to those. I'll probably answer a good portion of them throughout this, but and I'm just going to jump right into it. So Hydrate truly is is really the only option in this industry, as we've made this to be a completely turnkey for nurses. Okay, so really they help us be compliant and structured properly in our state. So no matter what state you're in, you would be structured properly and compliant with like corporate practice of medicine laws. They're going to do that to protect your license, protect Hydrate's medical network, and protect the medical director's license. And they're going to do that several ways. One of the ways is they do have medical directors that you can partner with that are in all 50 states. They're ready to go. And the second way is they do give you the medical malpractice insurance completely included. And that's for whether you're doing it by yourself or you bring on other nurses to do it with you. Everybody is covered, whether you're brick and mortar or you're mobile. And I don't know if anybody has looked into what medical malpractice cost for doing like mobile IV hydration, but it's around $6,000 to $10,000 a year. So they're 100% including that with this opportunity. And the third way is you're actually joining the Hydrate medical network. And it's really because of the way that they've structured their medical network that keeps us compliant and structured properly. Okay, so really, whether you're doing, IV infusions or vitamin injections, you can really do any medical service with this platform. Everything really truly boils down to the app. Okay. And I really mean that it's every aspect of this business. You can do your booking and scheduling through the app. You can set travel fees, cancellation policy, membership plans, lifetime rewards, gift cards, and you can do all of your billing or point of sale through the app. You can do debit card, credit card, HSA, and FSA cards. So I would have had no clue how to do that on my own. And so I was really grateful to see that they include that with this app. The app is also all of your EMR. So it's going to do all your proper documentation. It stores the client's intake, consent, medical history. It's all stored right with the client on the app, and it's all HIPAA compliant. So, and we all know about HIPAA because we've all done those classes every year. So it does come with a beautiful IV menu that has been designed by a doctor of pharmacy. And there's several IVs like immunity, performance recovery, beauty and youth. There's migraine, detox, prenatal, energizer, fat burner. And then they do IM injection menu like B12, vitamin D, and MIC for weight loss. And you, of course, can do all of those, or you can focus on just a few if you wanted. You truly are the ones in the driver's seat because this is your business. Okay. When you partner with a Hydreight medical director, you do get his standing orders, you get his policies, his procedures, his protocols, which are basically a step-by-step guide on how to administer each and every one of those services. Okay. Ordering supplies is super, super easy. So Hydreight has their a Hydreight pharmacy, which you can get to through the app. And there you order your IV kits, your medications, your hardware like IV poles and sharps containers, and supplies like all the way down to Band-Aids. They've partnered with, I think, 4 of the largest 503B pharmacies across the United States and put it all in one location for us to make it easy for us to be able to order, along with supplies. And then they are going to help do marketing for you. They're going to market in cities specifically where they have partners. So I know that, Facebook and, oh gosh, TikTok is getting huge now, and Hydreight has a TikTok. And so they're constantly posting on there and, trying to draw people to the app. But they also have a partner portal. And with that partner portal, you can get pictures and posts and files and things that you can use for your own social media to advertise for yourself on Facebook, Instagram, TikTok, build your own website. You can take all the pictures right through that partner portal and use them on any of those platforms. And anything else that you need, like business cards, banners, brochures, you're able to get through that partner portal. So we are all 1099 at the, and they send you the 1099 at the end of the year, and they pay out profits every Tuesday and every Friday. So whatever services you've done is when you get paid out Tuesdays and Fridays, which I think is great. If you bring on other nurses to work with you, because I know a lot of you are travelers and you might, want to bring on other nurses to help you out. And so Hydrate really does make that easy for you. The person just applies right through the app, and Hydrate takes over from there. They're going to check their nursing license, make sure it's unencumbered, do a background check, get their driver's license, their driver's license and their insurance for you if they're mobile. They're going to give them HIPAA training and a HIPAA certificate. They're going to train them on the EMR, how to find those standing orders, how to take payments. And then you get to decide how much those nurses are paid. And you set that in the app, and then Hydrate will pay them out based on the services that they did every Tuesday and every Friday. And you can get a detailed report that's going to break down, the services they administered, who the clients were, what the cost was, what they got paid. And it just breaks it all down for you. And then you get the profit sent to you every Tuesday and every Friday. And again, they're also 1099. So they've really taken it, for easy terms, a business in a bag, in a sense. You don't need an LLC to do this. They really have handled everything, done all the legwork for us, and just made it easy for us as nurses to be in business for ourselves, whether you're trying to do this as a on the side as part-time, the side hustle, or you want to take this into something full-time. It's very easy to be able to do either way. So I know that all of you, and I mean, really, that's about all the information in regards to Hydrate. But I'll tell you the cost. There is a couple costs. There's a commission side, and the commission works. Hydrate's going to take 10% of every sale, and that's truly a management cost for really all the programs they put in place: the medical malpractice, the medical network, the app, the tech team, the pharmacy team, the marketing, and everything else that they do. It's a 10% management cost. And then if you partner with the Hydrate medical director, he only charges 5%. I don't know a medical director anywhere that only charges 5% besides Hydrates. So if your client uses a debit card or credit card, there is a 2.99% merchant processing fee that goes to the merchant. So at the very most, you're looking at 18% total. Now, on the other side is the annual subscription fee, and that's an annual subscription fee for joining the Hydrate Medical Network. The price is normally $5,999, but they were a title sponsor of the National Nurses March. And so they're really trying to get behind the nurses of America with this nurse initiative. And they are discounting this down to $2,999. And what they're doing with that is anybody that signs up at this $2,999 is also getting a $500 pharmacy credit. And let me just talk about the pharmacy credit for a second. Really, with this $500 pharmacy credit, you can make back your initial investment of $2,999. So just for an example, if you had a $50 vial of 5 milligrams per ml, let's say B12, and it's a 30 ml bottle, which is what most of the B12 comes in, the dose is a 0.2 ml. So there's 150 doses in that bottle. And most people are charging I'd say $20 per injection. Some people maybe $25 per injection, but with simple math, that's just $3,000 off one $50 vial. So then you have another $450 in credit. So you can imagine the possibilities there. I do know that $2,999 is a limited time. So we're doing these webinars, we're taking calls. They are projecting that this cost is going to go up by the end of the year. One of the nice things about the way they designed this annual subscription fee is that whatever you pay when you join, like the $2,999, then you are grandfathered into that cost. So next year when you renew, even if Hydrate is $10,000, you're still only going to pay $2,999, and you're going to pay that for the lifetime of your contract as long as you continue to renew. So that's a really great thing about the way that they've done this. And I guess really, Abby, that's, everything.
Great, thanks so much, Tamara. And yeah, we'll pass off to some questions too. I do see some in the question section too. So I do want to start. There is one. Is that the same subscription cost for multiple? So say there's multiple nurses, like you're going in with a few other nurses. Is it just that one subscription cost that you have to pay?
Yes, it's that one subscription cost that you have to pay that you could split between a couple nurses if you wanted, and that would be per area. So let's say you wanted to have an area in California, you would pay that. If you want to have an area in New York, you would pay that. You want to have an area in Florida, and I say that because travel nurses, we all travel. And so they do, move around, but you could have more than one area and it would still be that $2,999 per area. And you could split that among a couple nurses. Yes.
Great. Thank you. And then we do have another one here. It says, what if we didn't get the 500 pharmacy credit when signed up? You will get it. I'm not quite sure if this is someone who's already signed up, maybe. Send us an email. And I can look into that for you, but everyone who does sign up from this webinar will be getting the $500 pharmacy credit for sure. But please send us an email if.
Well, I do know that the $500 pharmacy credit, Abby, is a new promotion that they weren't offering that. Like they've offered different promotions at different times. And so that's the promotion that they're offering right now. But I know that at other times they offered, 20 free IV kits. So they periodically change that offer.
Yeah.
based on feedback that they get from partners. So that's what they are offering now. And I know that that just started as of the 1st of August.
Yeah, and I know with Access Health, we're making care, we're giving this offer too. So extending it to this
Right.
webinar audience too. So that's definitely something to keep in mind too. And then in the chat section too, I've just also put in Tamara's Calendly link, as well as both of our emails too. If you guys had any other inquiries, please do not hesitate to send us a note there or sign up. And then we do have another question, a few other questions here too. How about those who want to start as a side gig? Is it still $2,999 or only for those who want to do it full time? Great question.
Yes, it is still $2,999, regardless whether you're doing this as a side gig or as full-time. But that's the cost for joining the medical network. And the medical network is truly what keeps us compliant as RNs, being able to do this on our own and own our own business. Like with a lot of corporate practice of medicine states, the MD has to own 51% of a business, but because of the way that Hydrate has structured their medical network and with us joining them, then that's what keeps us compliant and not having to have that medical director owning 51%. So yes, that's regardless if you are doing it as a side hustle or full-time. But let me just break down something for you guys real quick so that you can understand the potential of where you can go from side gig to full-time. So your net profit on an IV drip is everything after you've deducted your 10% to Hydrate, 5% to medical director, 2.99 for credit card, and then whatever it costs you for your cost of goods per drip. And the average cost of goods per drip is anywhere from $30 to $40 per drip. So if you price your drips and you get full ability to put the price on it that you want. So if you price it so that your net profit after all of that is $150 and you did, and I hate to say like 2 drips a day because none of us want to work 7 days a week, but on average, 14 drips a week, which is nothing. I mean, that's less than 4 in 4 days, 4 days, that would be 16, but at $150 net profit, based off 2 drips a day, your net profit for the year is $109,000. So if you're just looking to do it as a side hustle and you just did the 14 drips, which is, again, 14 is nothing. And, I think of everything in the sense of an average that, if I average 14, and of course there's weeks that my nurses only do 8 or 9 drips, but then there's weeks that they do 28 or 30 drips. So in an average of 14 drips in a week. So the potential is there. If I was averaging 28 every single week, which absolutely we can get there without a problem, my net profit then is $218,000 a year. So Hydrate has really made this for us to be able to, I guess, put the power back. I don't want a hospital. I know you guys are travel nurses, so you guys make a little bit different money than a staff nurse, but I don't want a hospital tell me I'm only worth a 25-cent raise. I want to be responsible for what I feel like I'm worth.
Great. Yeah. And also like that price is grandfathered in. So no matter what price next year or the year after, you're going to have this price for life, really. So that is something to keep in mind. A few other questions here. We have, so all inventory like IV start kits, are they purchased by the nurse?
Yes, you would purchase all of your inventory. The IV Start Kit really comes with everything that you need to be able to do a basic hydration. It's going to come with a liter of fluids, and you can pick LR or NS. It comes with your 20 gauge blood control IV catheter. It comes with the Start Kit that has the Tegaderm, the tourniquet, the 2x2, and the alcohol wipe. And it comes with a 18 gauge blunt tipped needle, the tubing, which is a dial flow tubing, and it comes with like a 50 cc syringe. So all of that comes in one kit together. You could basically just order that and just do hydration without any vitamins. But again, with this and with the partnership with Access Healthcare, is that you're going to get that $500 pharmacy credit. So you'd be able to get stuff to get started and make back your money.
Yeah, and just to add on to that, are we able to purchase IV pulls from the pharmacy also? Yes, so everything from supplies, anything you need is found on the pharmacy, and that's just through the app. In the back end, direct link to the pharmacy, and you can order it right then and there. So it's very convenient to you. You're not having to go out and source this. Like Tamara said, we have large partnerships with quite big vendors, Medline, Olympia, Empower. So a lot of opportunity and inventory there for sure. So we do have a few more questions here. Tamara, we got, can LVN do this?
Absolutely. If depending on your state's scope of practice for an LVN, like in regards to compounding and pushing, because like certain things like glutathione is done as an IV push. So depending on your state's scope of practice, but even if you as an LVN or LPN are not able to do it in your state, you can employ the people to do it. And that's one of the great things about Hydrate is they've made it easy for us to be able to employ people with helping with doing all the training, the 1099 and the payroll.
Great, thank you. And that's where it also helps with a few of you getting together and, and splitting the subscription, and then what you're good at and what you're licensed to do, kind of split it between the two of you or three or however it might be. So a few more questions here. As we know, your time is precious. So do you go to people's home to provide service, or do they come to you?
So I'm fully mobile. So we go to people's homes, we go to their offices. I have a lake near me. We've done it right on the lake. I've gone to campsites. I mean, really anywhere. We've done events. You can do events with this. People have done marathons, mud runs, festivals. You can do that also. But you can also, if you wanted to be a location, a brick and mortar type location or storefront, you could absolutely do that too and have people come to you, or you could do both. And the nice thing is that the medical malpractice is going to cover you whether you are brick and mortar or whether you are mobile.
Wonderful, thank you. And just to add on to that, this question kind of ties it in to what you're saying. There's events, mud runs, marathons. So the next question is, how do you find people to work up to the 14 IVs per week? I think, if you do one event, a marathon, and you're stationed at the end of it, you just offer 2 IVs and like a B12 shot, and you just line people up, you can hammer out like 10, 20, in 1 hour or 2 hours, right? So you're going to instantly get people there. Plus a lot of local, if it's a marathon, you're going to get a lot of people from your local community in that area that come, and then you'll kind of get the word of mouth out there as well. So that's great too. But I don't know if this person is also asking about the nurses to work for them, or if it was just administering who to give it to. But I would say that would be an opportunity where you can literally just do a couple hours and, make those
Can
IVs.
I jump onto that, Abby?
Yeah, for sure.
If you're referring to like, how do you get the clients for getting 14 IVs in a week? There's a couple different things that are super, super easy to do. Every city across the United States, Facebook has local groups. Post in there. I gave away free IVs to a couple friends in exchange for them posting. Hydrate has a program that you can get an Instagram influencer you would give them the IV, Hydrate pays them, and get Instagram influencers that have a whole lot of following. So there's a lot of different ways besides just handing out flyers at gyms. And I personally love hairdressers because they have different clients in their chairs every single day. So, you can even offer affiliate links so that they're earning a little bit something to give your link out. And so there's a lot of different ways to get clients. If you're talking about how to get nurses, I literally posted something on my Facebook. I was going to be doing an event. I needed nurses. I posted on my Facebook, hey, nurse friends, because when I worked in a hospital, even as a traveler, I made friends with other nurses there that were local, So I posted, hey, friends, I had people that were not nurses tagging friends of theirs that were nurses. And so to get those people, and then they just go through the app and they apply for your location, and Hydrate's going to handle the rest for you.
Great, thank you. And I think, I think that's great to end it on that note. And if there's any other questions that do come in, please do not hesitate to send us an email, book a call with Tamara, follow up 101 or whatever it may be. We're very thankful for your time. Any closing words, Tamara or Mark?
No, I think I've spoken a lot.
Thank you, Tamara, for your insight into Hydrate, and thank you, Abby, for the coordination of this meeting. Thank you, Jess, who's a sleeper over there, who also coordinated a lot of this. But we're hosting another session on Thursday. If you'd like to come back and learn more, ask them additional questions. But wanted to say thank you to everybody for participating and contributing to this discussion. I think this has been great.
Yeah, thank you so much. And we just want to say thank you so much for everything you guys are doing and for your time. And we hope you have a wonderful rest of your day too, and hope to see you guys as part of the Hydrate network too. Have a good one. Bye now.
Thanks.